Hello, good morning. It's Nancy Rhodes, the nurse practitioner, here today to do a video for you regarding dental care. You know, right now we're in a crisis with the COVID-19, and even when we're not in this situation for our homebound patients and people, it is important to have good dental care. Otherwise, you'll end up having emergencies, and it's really a difficult thing. So let's talk about some very good information that I've gotten from one of my dearest friends from India. Being on YouTube is such a wonderful thing because social media allows the world to become very small, and I get contributions from all over, and it's been very fulfilling to know that people are listening or getting something out of what I'm saying. So the first thing I want to say is that you need to have a good toothbrush. Toothbrushes should be changed every 3 to 4 months. I will actually throw my husband under the bus, but he says he hasn't changed his toothbrush in 2 years. The bristles get hard and brittle, and they spread apart, and then they can cause a lot of damage to the gums, and it's not effective. So make sure you get a new toothbrush. You can get them soft, medium, hard, whatever, but make sure you get a good toothbrush every 3 to 4 months. The important thing when you're brushing is when you do the front teeth or the canines, which are the pointy ones, that you're brushing not horizontal, but you're brushing up and down, okay? And you want to include the gums a little, and don't brush hard. Also, if you're doing the molars, when you get back there, you can do a circular motion. And you want to really brush between each tooth and trying to just get in between there. One meal a day, you should be dental flossing. And I have these that I love, but unfortunately, I'm finding them all over the street, and they're becoming like cigarette butts, and they're garbage. So be careful. Have them, if you're going to use them at home, of course, put them in a plastic bag so they don't land up all over the street in front of your house. And also, or you can also get this floss. I don't really love this kind of floss because I think I have trouble getting around my teeth, but some people do great with it. Dentists always give us out freebies whenever we go. All right, let's keep going here about what to do. You should rinse your mouth after every meal. If you're looking for a mouthwash, you can certainly use a warm saline, which is salt water, with lemon juice in it every day. If you find that your gums are getting a little spongy, you know, they're bleeding and they're a little swollen, definitely use lemon juice and warm saltwater rinses. They will definitely help, as well as vitamin C sources. So get yourself 500 to 1,000 vitamin C once a day. Now, this is fine for people who have do not have hypertension, but if you have hypertension, you do not want to use saline rinses. We'll talk about that in a minute. So people with wisdom tooth pain or pain in the back of the molars, warm saline gargles are good, and they will really rinse off any debris and germs from that area. Avoid processed sugar and foods. I love Twizzlers, and I know they're bad because they're chewy and they probably are sitting on my teeth. So try to avoid those, especially this time when we can't get to the dentist, because pieces of this chewy candy sticks between our teeth. It's hard to get out, and that's where we start to get dental decay, and our teeth get, our gums get infected. Best time now to especially eat healthy. Healthy foods also cause healthy gums and healthy mouth. When I used to do exams on my patients, I always looked in their mouths and at their teeth and asked them when they went to the dentist last. It's very important to have a good, healthy mouth. We do have a flora in our gut that should remain healthy, and we also have a flora in our mouths. So cook good food, fresh foods, eat a balanced diet, high in fiber, rich in vitamins. And even though we're kind of home and we're not on a schedule, try to stick to some good, decent meals and stay on a schedule just to keep a healthy mouth. Another very, very important thing, as we know for all of us, is that we need to drink a lot of fluids during the day, especially water. And, you know, I like unsweetened cranberry juice with seltzer. You know, that's okay. I don't drink that all the time. I like water mostly. I do not use sugar in my coffee. I use like a coconut non-sweetened creamer that is not, it's coconut milk. So hopefully that'll help me out cholesterol-wise. Never use your teeth to open a beer bottle. I remember some guy I met in Canada on our honeymoon, and he was cracking open the beer bottles with his teeth, and I was like, holy cow, I wonder what his teeth look like now. That was years and years ago. So do not use your teeth to cracked nuts, open beer bottles, soda cans, anything like that. Chipping of teeth will definitely happen. Consider getting a water pick. They're very good if you find that you have a lot of new caps in your teeth. They get in between. That there's a new water pick that's actually from Waterpik. It's called Water Flosser, and I think it gets in between the teeth, and it actually does a really good job. I use an Oral-B thermometer, Oral-B toothbrush. What's cool about it is I tend to be very aggressive when I brush my teeth, and so the good thing about it is it kind of makes a buzzing sound when I'm going too hard on my teeth to slow it down. They can be expensive, of course, and then you have to replace the parts whenever it's like 3 months. So they're not without cost, but I've had gum disease all my life, just receding gums, I should say, and I've managed to keep all my teeth because of using these good hygiene in my mouth for sure. Don't forget about mom who wears dentures. Dentures should be taken out every day and be cleaned in some over-the-counter Polident or something like that. Make sure that you also brush her tongue. I found it very interesting that people would take care of the patient in the bed. I'd go in and visit, their hair is combed, they have beautiful clothes on, they look great, and I'd open up their mouth and there's food all over the place. That is definitely part of hygiene. To prevent bad breath, there's actually this really great mouth scraper. It goes on the tongue and it scrapes your tongue and it removes all the extra debris. So when you brush your teeth, brush the roof of your mouth, and mom's, brush her gums, even if she has no teeth, brush her tongue, and you could get one of these just to kind of clean the tongue off. This is also great for when I'm trying to determine if people have fungal candida on the tongue. If I can remove all the debris, then I know it's not fungal, but if it stays on the tongue, this white stuff, it usually means there's a fungal situation in the mouth. I also look for something called leukoplakia, which is patches of white that I've seen actually in some of my patients in a nursing home, and it's like a cancerous buccal lesion that would need to be seen by a dentist as soon as possible. Another cool thing is Toothettes. They come in little bags like this, and they're like spongy things on a stick. Biotine is a wonderful mouthwash that helps with moisture in the mouth. You could just dip this in the cup and just wash and really get into mom's mouth around whatever teeth she has left, and she could suck on and then spit, or you can actually rinse and put it in a cup and back and forth and use more than one to get all the food out. These are really, really great. They come in a bag of like 30, and you can get them in any medical supply store or any of the drugstores. Let's talk about diabetics and hypertensive people. They have to treat their gums a little differently than the rest of us. First of all, we need to say that metformin for the diabetic is known to cause reduced salivary flow, which means your mouth gets dry. And when you don't have enough moisture in your mouth, dry gums cause teeth to fall out eventually. So you need to supplement with vitamin C if you're on metformin and you have diabetes. Also, as we mentioned before, plenty of water helps to bring moisture. Biotine also brings a lot of moisture in the mouth. Make that part of your daily regimen for cleaning your gums and your mouth. If you want to use a mouthwash, commercial mouthwashes are not a good idea for somebody who's diabetic because of the high alcohol content in them. And there's usually some periodontal disease already for the diabetic. So stick with chlorhexidine in it and look for that in the actual bottle. Also, we talked about vigorous brushing. Do not brush too hard. It's a good idea to keep track of your blood sugars, making sure that they're stable and in good range. And good old systemic health, like we talked about, good eating. For the hypertensive person, oral manifestations are not the same, where the gingivitis does not show. So you have to really pay attention. Usually they do complain of dry mouth. They might even have salivary gland swelling, and that could just be noticed by the person they actually get calcifications or little stones in the salivary gland area. Gums can be covered all the way up to the teeth, so they actually get this like fluffy gummy look. So when dentists look in the mouth of a hypertensive person, they would be able to tell if they're doing okay or not. Some of the other symptoms hypertensive people may get is like a pins and needles or like a a prickly numbness feeling, and that's from restricted blood flow to the gums. So watch for those symptoms if you're hypertensive. And the other thing is the taste sensation may alter, where a salty taste, especially from ACE inhibitors like lisinopril, ACEs, look up what ACE inhibitors are, and if you're on one of those, which is a common medication for hypertension, it may actually cause an alteration in salty taste. So, which means you might want to use more salt, and then your blood pressure goes up. So let's be careful about any kind of salt. So for people that are hypertensive want to use gargles, you can use a warm citrus gargle, and you can also just use warm tap water, which is just great. Let me see what else our lovely friend mentioned here. For toothpaste and mouthwashes, I use Sensodyne. I have sensitive gums, so that's really kept the sensitivity of cold off my teeth for many years. So I've been very fortunate to be able to get that under control with regular flossing. I also wear a mouth guard, which I won't dare show you, but one of those people who grind their teeth at night. I've been doing that for years, but I have this mouth guard that I'm just keeping alive until I can get a new one, and I actually have this little tiny brush to clean it. So every day I just run it under warm water after I use it all night and just rinse it off and air dry it, so that I don't use any mouthwash or detergent on it or toothpaste, and it's holding its own. It's like 6 years old. Gross, but it works. So if you find that you're grinding your teeth and that you have, pain in your gum, in your jaw, and that it clicks and stuff, you definitely need to mention that to the dentist, because you could have something called TMJ, temporal mandibular joint disease, which can be treated and you'll feel much better. If your dentist gives you a medicated toothpaste, use it until it's gone. It's almost like an antibiotic. If you're given it, complete the course, because it's only supposed to be used for a period of time, and then you're supposed to stop using it and going back to your regular toothpaste, unless your dentist wants you to continue for an indefinite period of time. But once it runs out, check it out with the dentist first. Okay. Check the content of the alcohol we mentioned in your mouthwash. The less alcohol content, the better. So, compare the brands. I don't know how good, but it does say alcohol free, and I use Tom's. But this has sea salt in it, so this would not be good for a diabetic, but for a hypertensive person. But it's got refreshing mint in it, and one of the ingredients you want to make sure it has is that it doesn't have sugar, which this one does not, but you want to have something called xylitol in it. So I'm going to teach you how to make your own homemade mouthwash. You can take 10 drops of peppermint oil, or any flavor that you like. This one, like I said, does have peppermint in it, some kind of a mint. And it should not be processed, and it should not be sugar-based. Then you could take 1.5 ounces of xylitol, which is called a birch sugar. It is a substitute sugar, but it's a natural flavor. Baking soda, 2 teaspoons, of 2 cups of lukewarm water, and an empty glass bottle. Shake it up really good, and there you have a really nice mouthwash that can be used every day, and it's homemade. You don't have to buy it in the store, and you don't have to worry about sugar, and you have to worry about extra ingredients in it. I will post this little recipe on my facebook.com/caregiver success if you'd like to download that and make your own. If you don't have birch sugar, please do not use natural sugar. The xylitol is a sugar substitute, okay? It's also anti-carcinogenic, which is great, and it will protect the tooth from decay. So sounds like a really good substitute sugar to put in your mouthwash and have a natural mouthwash. Happy Dent chewing gum has xylitol in it. If you want to get this chiseled jaw, they say if you chew gum, it makes your muscles stronger, and it also allows the deposits of this to go onto your teeth and support them and protect them. And a couple more things I would like to go over from the American Dental Association. We talked about brushing your teeth at least morning and every evening. We talked about replacing your toothbrush. Buy products that have been ADA seal of approval, and many of them have been out there since 1931. That's a long time. Floss your teeth twice a day, or at least after the major meal, especially if you have meat. If you have pockets that you know of, areas that tend to hold food, definitely got to get in there 2 or 3 times a day, or else you're going to have bad breath, even if you use mouthwash and even if you scrape your tongue. If you smoke, it's really important to stop. It has a terrible effect on gum disease. And when you go to see your dentist, when that time comes again, bring all your vitamins, your list of medications, that if you have any allergies, all your healthcare providers. If your dentures need to be fitted, it's a good time to bring them, because if mom's dentures are not fitting, or she's only wearing the bottoms, not the top, you're going to find that she's not going to be eating right because she can't eat certain foods. You could always puree some of the foods, but it's just not the same. And as you get older, you lose your taste buds, so the interest in eating lessens. And of course, if you don't have a good daily diet, you're going to get sick. So we got to do our best to make sure people keep their teeth as long as they can. And just because you get older doesn't mean you're going to lose your teeth. You don't have to lose your teeth. Okay, so I think we've covered mostly everything here. If you have any questions or you have any comments, you can answer me on nancythenp@gmail.com. And stay well, take care of yourselves. We're all in this together. And talk to you at the next video. Bye.